Epilepsy. Epilepsy is a focal sensory system, neurological, jumble in which mind movement gets strange, causing seizures or times of uncommon conduct, sensations, and at times loss of mindfulness. Anybody can foster epilepsy. Epilepsy influences the two guys and females, everything being equal, ethnic foundations and ages. Seizure side effects can fluctuate generally. A few group with epilepsy basically gaze vacantly for a couple of moments during a seizure, while others over and again jerk their arms or legs. Having a solitary seizure doesn't mean you have epilepsy. At any rate, 2 ridiculous seizures are by and large needed for an epilepsy finding. Treatment with prescriptions or now and again medical procedure can handle seizures for most of the individuals with epilepsy. A few group require long-lasting treatment to control seizures, yet for other people, the seizures in the end disappear. A few kids with epilepsy may grow out of the condition with age. Epilepsy. Side effects. Since epilepsy is brought about by strange action in the mind, seizures can influence any interaction your cerebrum arranges. Seizure signs and manifestations may include transitory disarray, a gazing spell, wild yanking developments of the arms and legs, loss of cognizance or mindfulness, mystic manifestations like dread, tension or this feels familiar. Manifestations change contingent upon the sort of seizure. Much of the time, an individual with epilepsy will in general have a similar sort of seizure each time, so the indications will be comparative from one scene to another. Specialists for the most part arrange seizures as either central or summed up, in view of how the strange cerebrum movement starts. Central seizures. At the point when seizures seem to result from strange action in only one space of your cerebrum, they're called central, halfway seizures. These seizures fall into 2 classes. Central seizures without loss of awareness. When called basic halfway seizures, these seizures don't cause a deficiency of cognizance. They may modify feelings or change the manner in which things look, smell, feel, taste or sound. They may likewise bring about compulsory jolting of a body part, like an arm or leg, and unconstrained tangible side effects like shivering, wooziness and blazing lights. Central seizures with debilitated mindfulness. When called complex incomplete seizures, these seizures include a change or loss of cognizance or mindfulness. During an intricate fractional seizure, you may gaze into space and not react ordinarily to your current circumstance or perform dreary developments, for example, hand scouring, biting, gulping or strolling around and around. Side effects of central seizures might be mistaken for other neurological issues, like headache, narcolepsy or psychological sickness. An exhaustive assessment and testing are expected to recognize epilepsy from different problems. Summed up seizures. Seizures that seem to include all spaces of the cerebrum are called summed-up seizures. 6 sorts of summed-up seizures exist. Non-appearance seizures. Non-appearance seizures, recently known as petit mal seizures, frequently happen in youngsters and are portrayed by gazing into space or inconspicuous body developments, for example, eye flickering or lip smacking. These seizures may happen in groups and cause a short loss of mindfulness. Tonic seizures. Tonic seizures cause solidifying of your muscles. These seizures typically influence muscles in your back, arms and legs and may make you tumble to the ground. Atonic seizures. Atonic seizures, otherwise called drop seizures, cause a deficiency of muscle control, which may make you abruptly break down or tumble down. Clonic seizures. Clonic seizures are related with rehashed or cadenced, yanking muscle developments. These seizures as a rule influence the neck, face and arms. Myoclonic seizures. Myoclonic seizures generally show up as unexpected brief jerks or jerks of your arms and legs. Tonic-clonic seizures. Tonic-clonic seizures, recently known as excellent mal seizures, are the most emotional kind of epileptic seizure and can cause a sudden loss of awareness, body hardening and shaking, and in some cases loss of bladder control or keeping quiet. When to see a specialist. Look for guaranteed clinical assistance if any of the accompanying happens. The seizure keeps going over 5 minutes. Breathing or cognizance doesn't return after the seizure stops. A subsequent seizure follows right away. You have a high fever. You're encountering heat fatigue. You're pregnant. You have diabetes. You've harmed yourself during the seizure. On the off chance that you experience a seizure, interestingly, look for clinical counsel. Causes. Epilepsy has no recognizable reason in about a large portion of individuals with the condition. In the other, a large portion of the condition might be followed to different components, including hereditary impact. A few kinds of epilepsy, which are ordered by the sort of seizure you experience or the piece of the cerebrum that is influenced, run in families. In these cases, almost certainly, there's a hereditary impact. Scientists have connected a few kinds of epilepsy to explicit qualities. However, for a great many people, qualities are just essential for the reason for epilepsy. Certain qualities may make an individual more delicate to ecological conditions that trigger seizures. Head injury. Head injury because of a fender bender or other horrendous injury can cause epilepsy. Cerebrum conditions. Mind conditions that cause harm to the cerebrum, for example, cerebrum tumors or strokes, can cause epilepsy. Stroke is a main source of epilepsy in grown-ups more established than age 35. Irresistible infections. Irresistible infections, like meningitis, AIDS and viral encephalitis, can cause epilepsy. Pre-birth injury. Prior to birth, children are touchy to cerebrum harm that could be brought about by a few components, like a disease in the mother, helpless nourishment or oxygen insufficiencies. This cerebrum harm can bring about epilepsy or cerebral paralysis. Formative issues. Epilepsy can now and then be related with formative issues, like chemical imbalance and neurofibromatosis. Hazard factors. Certain elements may build your danger of epilepsy. Age. The beginning of epilepsy is generally basic in youngsters and more seasoned grown-ups. However, the condition can happen at whatever stage in life. Family ancestry. In the event that you have a family background of epilepsy, you might be at an expanded danger of fostering a seizure issue. Head wounds. Head wounds are liable for certain instances of epilepsy. You can lessen your danger by wearing a safety belt while riding in a vehicle and by wearing a cap while bicycling, skiing, riding a bike or participating in different exercises with a high danger of head injury. Stroke and other vascular infections. Stroke and other vein, vascular, sicknesses can prompt mind harm that may trigger epilepsy. You can find various ways to diminish your danger of these sicknesses, including restricting your admission of liquor and staying away from cigarettes, eating a sound eating routine, and practicing consistently. Dementia. Dementia can build the danger of epilepsy in more established grown-ups. Cerebrum contaminations. Diseases like meningitis, which causes irritation in your cerebrum or spinal string, can build your danger. Seizures in adolescence. High fevers in youth can in some cases be related with seizures. Kids who have seizures because of high fevers for the most part will not foster epilepsy. The danger of epilepsy increments if a youngster has a long seizure, another sensory system condition or a family background of epilepsy. Entanglements. Having a seizure at specific occasions can prompt conditions that are perilous to yourself or others. Falling. On the off chance that you fall during a seizure, you can harm your head or break a bone. Suffocating. In the event that you have epilepsy, you're 15 to multiple times bound to suffocate while swimming or washing than the remainder of the populace in view of the chance of having a seizure while in the water. Auto crashes. A seizure that causes either loss of mindfulness or control can be risky on the off chance that you're driving a vehicle or working other hardware. Numerous states have driver's permit limitations identified with a driver's capacity to control seizures and force a base measure of time that a driver be sans seizure, going from months to years, prior to being permitted to drive. Pregnancy confusions. Seizures during pregnancy present threats to both mother and child, and certain enemy of epileptic meds increment the danger of birth surrenders. In the event that you have epilepsy and you're thinking about getting pregnant, converse with your PCP as you plan your pregnancy. Most ladies with epilepsy can get pregnant and have sound infants. You should be painstakingly checked all through pregnancy, and prescriptions should be changed. It's vital that you work with your PCP to design your pregnancy. Enthusiastic medical problems. Individuals with epilepsy are bound to have mental issues, particularly misery, tension and self-destructive musings and practices. Issues might be a consequence of troubles managing the actual condition just as medicine results. Other hazardous complexities of epilepsy are exceptional, yet may occur, for example. Status epilepticus. This condition happens in case you're in a condition of ceaseless seizure movement enduring over 5 minutes or in the event that you have successive intermittent seizures without recovering full awareness in the middle of them. Individuals with status epilepticus have an expanded danger of lasting cerebrum harm and passing. Abrupt sudden passing in epilepsy, SUDEP. Individuals with epilepsy additionally have a little danger of abrupt startling demise. The reason is obscure, however some examination shows it might happen because of heart or respiratory conditions. Individuals with continuous tonic-clonic seizures or individuals whose seizures aren't constrained by meds might be at higher danger of SUDEP. By and large, around 1% of individuals with epilepsy bite the dust of SUDEP.